My YouTube familia, we have an update, and it is a very exciting update for us reflux and GERD sufferers. Some of you guys have heard about it already. I don't know if you guys have, but of course, I'm gonna give you an update. And hopefully, this video I'm able to release this video soon, so you guys can be more aware of it. Remember that thing and that project that was happening for GERD and for acid reflux over there in Europe? Well, actually, today they had, or not today, I think yesterday or today, they had their first patient to receive the reflux stop procedure. Now, there was several of them that I mentioned throughout the time that I was doing my GERD videos and stuff for about 2 years or so. I believe one of them was not funded correctly or didn't get enough funding at all after the pandemic. But the reflux stop, if I'm not mistaken, kept going, and the news came out a day ago that the first patient in the UK has received reflux. So I'm gonna put the link up here so you guys can see it and read it with me. I haven't read it myself. I just seen a lot of posts online, especially from sites that I'm on online. So, but put it right here, and this is straight from the UK. It's called the Independent. Um, .co.uk. I'm going to leave the link in the description. You guys can click on it. You can read it yourself. But as you guys can read here, first patient in UK to receive revolutionary device to stop acid reflux and heartburn. And to be honest, this is very much exciting to see for me, and I'm sure for you guys if you're suffering from reflux as well. As you, this is, I'm assuming that this is the patient that received it, and this is the doctors and the surgeon. So let's read a little bit real quick. I hope you guys can see and read that. If not, I'll just all these ads, man. Jeez, I guess that's how they get the money, no? I'm a zoom in a little bit so you guys can see it if you're watching through the screen as well. So, the first patient in UK have had a new device implanted to prevent severe acid reflux disease, which it's a pin in the butt. University Hospital Southampton and Imperial College of London have become the first NHS trust in the country to install the device called RefluxStop. I don't know what does that mean? NHS National Hospital Society. I don't know if you guys know. If you guys are from the UK, and I do have people from all over the world, I would like to know what that means. Okay, so also down here, I know by the way, the ads I can't do anything about them. I don't think I'm not subscribed to the Independent, so there's not much I can do. So known as gastroesophageal reflux disease, GERD. Oh, they call it GERD in the UK. It's not GERD, it's GORD. Esophageal spelled with an O in front of it. Look at that. How about that? Okay. And we know what that is, so we're not gonna get into that. This can range the result of symptoms including heartburn, regurgitation, difficulty swallowing, bloating. Up, it happens. Muscular lower. Yep, lower esophageal sphincter. Let's see. Woman said the new. Okay, here we go. The spokeswoman said the new revolutionary device, RefluxStop, is fixed to the upper part of the stomach wall and blocks the movement of the lower esophageal sphincter to hold it in its original natural position and restore normal anatomy and function, which is really cool, right? This is what we're looking for. We're looking for original natural position and restore normal anatomy. We don't want to mess up the anatomy, as many of you guys have known and heard of the Nissen fundoplication that really just it's like scrambled eggs in there, man, when they do the surgery. So made out of medical grade rounded solid silicone. The implant measures around 25 millimeters, smaller than a ping pong ball. So that's actually nothing crazy. And is fitted via robotic assisted, so laparoscopic procedure basically. It says keyhole, not keyhole, so it's not plural. So maybe it's just one. I'm assuming it could be more than one hole, but like they're using it because it's a surgery. So um, in as a day case with patients, theater for less than 2 hours. Okay, so this is what it looks like. This is important, guys, to see the actual image. Look at that. I'm gonna add this a little bit more so you guys can see. Wow. That looks pretty cool. I'm not gonna lie. But the fact that that's in your stomach, man. Hmm. The first thing I wonder if you feel anything. You know what I mean? I wonder if like there's something that you actually feel because it's in your stomach. Like maybe it's like some bloatedness or some type of fullness that you feel. I'm gonna show you guys soon as well an image of what it looks like inside the stomach, so you guys just won't be like, "Yo, what is this?" Um, but that's an interesting object. By the way, I have not done the craziest research on this. Now that this is out and it's on trials and people are actually having to get it done, I'm definitely gonna do more research on it. But this looks really cool, guys. This looks awesome. And going farther down, the spokeswoman said that approximately 20% of UK population has problems. So this is basic knowledge. If you look at anywhere with GERD, 1 to 5 people. I think even here in the States, if like it might be like 1 to 5 as well, or maybe 1 to 10. I don't remember, but it's very, very common. At least GERD has become very common, and that's due to a lot of different reasons. So Danielle, the girl or the lady, the woman that had this procedure was 30 years old. Recently became the first patient with GERD to undergo the procedure. So mother of two. This is a life story. Okay. Let's see. And as usual, I mean, this is a basic thing, dude. Look at the prescribed medication. Proton pump inhibitors. I'm assuming to try to um get her symptoms done. By the way, this is the woman up here, very courageous. When it comes to having this done, 100% very courageous because it's one of the first people. So you gotta kind of have to be like a guinea pig to some extent. You know what I'm saying? To take this on, right? So so much respect for that, and it could, she's one of the first kind of stepping stones into maybe what we could go into in the future as GERD sufferers. So I'm gonna show you guys what the device looks like in the web page. I'm also gonna leave the link to the refluxstop.com webpage so you guys can take a look and read on it. But this is one of the procedures that I've always mentioned, guys, that I mean, I've known of this and this happening for like 2 years, maybe even more, I believe. But of course, it's everything. Technology is just gonna be a work in progress. And this is what it looks like right here. See if you guys can get a look at it. Look at that. So this is where. Oh, so it doesn't go in the stomach. Oh, I thought it went in the stomach, but it does not. It goes outside the stomach from what it looks like, and it's stitched up. Interesting. Actually, let me read this real quick. How does it work? Reflux stops. Let me read it on here. Um, Treats acid reflux without affecting the esophagus. A novel method that could eventually change the way acid reflux treated. The ingenious RefluxStop device is a non-active implant that is placed on the upper part of the stomach through the laparoscopic keyhole surgery. CE mark approval was granted August 2018. The strength of the multi-center clinical investigation in which the safety of effectiveness in the device patient was demonstrated. And you guys can read on the results here. I mean, it's showing that a lot of promise, to be honest. The baseline 86%, 98% study subjects had normal reflux levels after 1 year, which is actually 98%. It's crazy. That's super good. And side effects include bleeding, vagal injury, visceral injury. I don't know what visceral injury really means, but vagal, I'm assuming like the vagus nerve, and recurrent hiatal hernia, which not that great. Does that effects last? All right. Well, you guys can do more research on this. I just want to, I want to get. I just have the questions that I have are the basic questions. Man, I wonder. I still gotta figure out. I gotta go to YouTube and figure out how exactly like that device works exactly, as to how does that stop the reflux. And I gotta look at the technology behind it, right? But questions that come into my mind, for example, are I have the Lynx implant device now, and the Lynx, it's here right on the LES for me. Could I get this and have the Lynx right on my LES? Who knows? Or would I have to get the Lynx device taken out and have that implanted into the surgery? Now that this device is out, I know Dr. Smith, my surgeon, I think he will definitely start getting his hands on this because he's always been very proactive when it comes to new procedures and surgeries. So, I'm excited to hear what he has to say about this. Of course, I got to give it time. One thing I will say though, if it becomes available here in America, let's say in the next couple of years, I will still give it time, especially if in the way I am right now, which I'm able to manage my symptoms and certain things in my life. I feel like for these type of procedures, I think it's safe after like 5 to 10 years. This is my opinion, by the way, to try something new, right? First of all, I already had 2 surgeries in 2 years, which is the knee duplication first in 2017 and 2019, the Lynx implant, right? So I got to give it some time to see how people are reacting, how this woman specifically, Danielle, is reacting to this procedure, right? We want to see how it reacts with people. And what's the most important thing that we want to look at? The long term, right? Just like when you're doing anything in life, even investments, you look at the long term uh, data and see how people reacted to it, right? So that's one of the things that's on top of my mind. Um, and I'm just, I gotta give it time, even though this is a great step for a lot of us and for a lot of people that are suffering from GERD and acid reflux. It's a really good step. Now I will mention, if you guys haven't been keeping up with my videos, so my reflux, a lot of my reflux, when I did the 24-hour pH study, it showed that I basically had a regular amount of reflux throughout the 24 hours, but the content that was I was refluxing was not necessarily acid. It was other stomach content. Other, which is like I had no idea. Well, I did have an idea that there's other stomach content like bile, but I'm not sure if there is even more than that that's like happening in your stomach. I kind of really thought it was bile and just acid that that was working in your stomach, but I think the doctor was like there's other acidic juices that are coming up into your esophagus when he told me about the test results, and I'm like, damn. First of all, I didn't know the device could tell you that. And second of all, I didn't know there was multiple that was, working in there except just bile and again an acid reflux. So I wonder if this could, I'm assuming this pertains to all the acidic juices in your stomach and not just the acid reflux. Hopefully. But that's something that we have to investigate and we have to do. So I'm interested in knowing, guys, your thoughts. Again, I'm gonna leave the link so you guys can do your own research. I'm not gonna try to, talk, and yap about the process. I want you guys to read it and take it on your own. And then if you watch this video again, hopefully we have some of the same sentiments. But um, this is just a quick update to give you guys, and so you guys can get more involved and start doing your own research. Remember, I always told you this: there's only one thing that you can control when it comes to having surgeries, and that's doing your research. Doing your research when it comes to, first of all, the knowledge that's out there, the technology that's out there. Second of all, your surgeon, who's gonna do your surgeon, the amount of experience that they have when it comes to doing your surgery, right? You can control that. You can control taking notes in your stomach, right? I mean, taking notes in your brain about your stomach and your digestive system, what affects it, what time, when you eat what, when you're feeling hot, taking mental notes and keeping that, always on check. So to see if things are adding up, to see if the math is mathing, right? So that's something that's very important. Um, so this things like this that are coming out, stay on top of it. I told you I've heard of this, for a very long time already. I mean, what did they say here? 2018, when it was granted approval. I've known of this for several years, and I've always mentioned it in my channel. And this is one of the procedures that gladly it went through, and now it's being tested on people. So do your research. I want to know exactly, or I want to know you guys' sentiments, your feelings on this. I want to hear all the sides of it because I would love to, converse and see what you guys think about this. So this is a quick video to get you guys updated on life and on GERD things. course, my channel, that's what it was built on. So hopefully you guys got something good out of this. Don't forget to like, comment, subscribe to the channel. If anything else happens, especially with these type of news, I will keep you guys updated so you guys can also be informed with me, right? I'm not going to try to gatekeep, especially things like this from the people that are suffering from this. So as always, thank you guys for watching. And as usual, peace and love. See you guys on the next video. Deuce.